Hello students, I'm Dr. Punit Bhojani, OGGuru, and in this video we are going to discuss the list of most important topics in OBGY for the NEET PG and the INICET. Now this list is curated by me based on my years of more than 17 to 18 years of teaching students over the years. I have made this list and I'm very sure this will also be accurate in the upcoming INICET and the NEET PG. And one more thing before we begin the session, please do install the OGGuru app, and the link of the app is in the description. So please install the app where you can directly be in touch with me through the app and solve your doubts and also listen to the excellent videos. Now, so when we look at, we are going to divide this session, it's going to be a very short video. So gynecology and obstetrics. So let me first start with the gynecology, and I'm going to give you the list of most important topics or must know topics, and I will also give you the list of less important or good to know topics. Okay, so let us start side by side. We'll also keep on adding both the list. So this is the must know topic. You cannot go to the examination hall without knowing these topics. The other is like a good to know or a desirable to know, in which questions very rarely asked may come. So when we start with the gynecology, the most important topic, infertility. Now this infertility is a very huge topic. So in this, it is divided into subtopics. So what are the important subtopics? Okay, so very important, PCOS, hot topic, one question surely expected. Okay, so PCOS extremely important topic. Then when we look at tubal factor evaluation, HSG, histrolap, okay, so tubal factors evaluation, all these are also of course covered in my video lectures in detail. And then extremely important today, hystrolaparoscopy. Lots of MCQs are coming on the topic of hystrolaparoscopy, where do you use hysteroscopy, where do you use laparoscopy. We teach you with a game form which instrument to which is the investigation of choice for which condition. So these are extremely important topics. Next important topic, endometriosis. Again, a very hot topic nowadays, and questions are coming on this topic of endometriosis. So we should definitely do this topic very well. Okay, so endometriosis very important. Now male factor questions generally not coming but may come the semen guidelines, so we can just add this like good to know or desirable to know. Okay, so not the must know but good to know topics, that if you know these topics very good, this comes, here comes your male factor, infertility, something the question may come. IUI, almost a virgin topic, never asked. IVF, ART, of course I've discussed in detail in my video, but almost never asked. Yes, OHSS question have started coming, so students should basically know something about OHSS. So when you look at infertility, PCOS, endometriosis, hysterolaparoscopy, tubal factor evaluation, all this become the most important topics. Moving on to extremely important contraception, must know with all the latest devices and all the new things. Contraception becomes a very important, because you may get 1 to 2 questions, one specifically on OCPILs and one on IUCD and the latest LNG, IUD, Mirena, all that. Emergency contraception also becomes extremely important. I'm writing EC. And do not forget to revise the new MTP guidelines, because short questions are going to come on the latest MTP guidelines also, and the new changes which have happened in the MTP guidelines. So contraception MTP becomes a very important topic. Next, extremely important, primary amenorrhea. This is a short topics to examiners love this topic, and you are expected to know the topic of primary amenorrhea extremely well. In this specifically, the differences between complete androgen incest syndrome and your RMK syndrome extremely important, and even Turner syndrome questions are coming. So primary amenorrhea very important. Again, good to know secondary amenorrhea. Secondary amenorrhea is never ever asked, but it may come, and again cryptomenorrhea questions occasionally may come. So as I said, these are less important. It's not that questions will never come, it's a good to know topics, definitely. Cryptomenorrhea. Okay, so primary amenorrhea, extremely important topic. Then moving on to the next important topic is our topic of menorrhagia or heavy menstrual bleeding. So again, in this everything, okay, menorrhagia or the heavy menstrual bleeding, very important. All the latest classification, you should know the different age-wise group causes, etiology management, extremely important. Again, a must-know topic, fibroid, because based on this, definitely one MCQ would be coming on fibroids also. Okay, moving on to the next, prolapse. Not a very important topic. Occasionally a question may come, but prolapse somehow we have not seen too much of the MCQs in your NEET PG and ICT, but may or may not come. So prolapse less important compared to others. Extremely important, infection. By this I mean the vaginal infection. One question surely comes. Sometimes if you are lucky, even 2 to 3 questions can come on the topic of infection. Now this infection, I mean the candidiasis, trichomoniasis, bacterial vaginosis, all that. So these are extremely important, and short one MCQ. It's a very easy topic. Do not get that wrong. Genital TB, very rarely asked. Okay, so genital TB may or may not come. Similarly, your PID, pelvic inflammatory disease, very rarely asked topic, but of course we have covered it in our videos in detail. Okay, so these are extremely important topics. Moving on to urogynecology. In urogynecology, the most important is the genitourinary fistula. Okay, so genitourinary fistula becomes the most important topic. Ureteric injuries is mainly asked to you in your surgery. Ureteric injuries I'm writing, and your SUI topic very rarely asked. Okay, so less likely, but may come in your INICET. Okay, so this becomes a very important topic. And then moving on to the cancers, the cervical cancer. Okay, the CA cervix, of course, must know topic. So cervical cancer is an extremely important topic. You should know this. Less important, HRT, menopause, almost never asked. CA endometrium, very rarely asked, but may come occasionally. A question may come on CA endometrium. And ovarian tumors or ovarian cancers, again very rarely asked, but may come in the exam. So your ovarian cancer is less likely. So this would cover majority of the gynec, and trust me, only these topics you need to know very well for your examination. Okay, so I just repeat the must know topics when we are going to look at the must know topics. Is the must know topics: infertility, big chunk, PCOS, tubal factors, hysterolaparoscopy, and also nowadays with hysterolaparoscopy, the Mullerian anomalies. Okay, the septate uterus, bicornuate uterus, all that. So Mullerian anomaly questions have also started coming. So endometriosis, OHSS, contraception, everything in and out, MTP latest guidelines. Then your most important, primary amenorrhea, menorrhagia or heavy menstrual bleeding, fibroids, infections, these are vaginal infections, genitourinary fistula occasionally may come, and cervical cancer the most important. So these are really most important topics. Do this very well, and I'm sure you will get all your marks in the exam. And then we look to know at the good to know topic or desirable to know topics. Male factor infertility, IUI, IVF, ART, secondary amenorrhea, cryptomenorrhea, prolapse, genital TB, PID, ureteric injury mainly asked in surgery, SUI almost never asked, HRT, menopause almost never asked, C endometrium, CA ovary occasionally asked. So this is going to be a very important list for your gynecology. Master these videos, and now I'll discuss the list for the obstetrics. Moving on to obstetrics. So in obstetrics, again, as I will say, obs, the must know, I'm going to write over here, the must know topics. So here, the most important, when we begin with trisomy 21, I cannot overemphasize the importance. Trisomy 21, that's your Down syndrome detection, all the screening tests. I'm writing double marker test, triple marker test, quadruple marker test, and all the confirmatory testing like your chorionic villus sampling, amniocentesis. So it's a hot topic. 1-2 questions surely coming. Do not forget the NT scan, very popular. So all these are covered beautifully in my lectures, and once you master the video, nothing more is required, is my guarantee. So trisomy 21 becomes an extremely important topic, NT scan and all the other USG. Then moving on to some important drugs. By these drugs, I mean the oxytocin, the methergin, and specifically prostaglandins. One question generally comes on the topic of drugs. Ultrasonography in early pregnancy, USG. Again, definitely the questions are coming. Now, as I said, must know ke baad, the good to know topics, something to do with the placenta variations. One MCQ is coming sometimes, succinturate low, battledore placenta. So placenta, various physiological changes. Because these are one-liners, the question may or may not come. The physiological changes which take place during pregnancy. Okay, so these are good to know topics. Then again, coming back, very important, the test for fetal well-being, that is the NST-BPP. Very important, short. Color Doppler, almost never asked till now, but will start becoming in the future exams for sure. So color Doppler, again, a very hot topic for the future exams. So this is your trisomy 21 drugs, USG, NSTBPP, color Doppler. Then moving on, extremely important, malpresentations. Malpresentations, more important than normal labor. Malpresentations, by this mainly your breech and transverse lie. Okay, so one question on breech, one question on transverse lie, oblique lie, very likely to be coming. Active management, third stage labor, again a very hot topic. Surely the questions are coming. Normal labor and mechanism of normal labor and the maneuvers and your control cord traction may or may not come. Of course, good to know topic, slightly less important. But overall, when you master these videos, everything will get covered. Okay, so after AMTSL, moving on to the next extremely important topic, that is the topic of must know topic, postpartum hemorrhage. Postpartum hemorrhage, surely one question for sure. VBAC or trial of scar, again one MCQ would come, and instrumental delivery, forceps and vacuum, one MCQ for sure. So these are all one questions which are surely going to come in the exam. So AMTSL, PPH, VBAC, forceps, vacuum, less likely. Shoulder dystocia may come. Cord prolapse, almost never asked, virgin topic, may come. So these are the less likely topics. Okay, less important, but you may want to know about it for sure. Okay, moving on, extremely last 2-3 years, as I said, normally one MCQ, but 2-3 questions are coming, and that is the topic of pre-eclampsia, eclampsia. In the last 2 consecutive years, 2 to 3 questions were there on this topic of pre-eclampsia, eclampsia, max self, monitoring, A to Z, when to deliver, everything we should know about pre-eclampsia, eclampsia. Moving on to heart disease in pregnancy, again a very important topic, heart disease in pregnancy, and diabetes in pregnancy, extremely important. All the screening tests, gestational diabetes, GDM screening, complication, when to deliver, please keep all this in mind. Anemia may or may not come, and other things like your thyroid disorders in pregnancy may or may not come. Obstetric cholestasis, okay, obstetric cholestasis, rarely asked topic. So these are going to be rarely asked topic. Ovarian mass in pregnancy, fibroid in pregnancy, this may or may not come. Do not forget, nowadays hot topic again, Apla syndrome, thrombophilia. Questions have started coming on Apla syndrome and thrombophilia. So definitely remember the complications and the management. Next important topic, and extremely important, antepartum hemorrhage. Maximum clinical questions are going to come from the topic of antepartum hemorrhage. By that I mean abruptio placentae, placenta previa, clinical cases you should know. Ectopic pregnancy, again a hot topic. Ectopic pregnancy, abortions or miscarriage, that is first trimester abortion, second trimester, causes are different, cervical length assessment, extremely important. Moving on, twins, very important, multiple pregnancy, twins, again short, and Leica disorders, that is your polyhydramnios and oligohydramnios. The rest of the topics which I will just mention over here, as I said, good to know, not so much frequently asked. Preterm labor, preterm, PROM, postdatism, again almost never asked. Okay, never asked. Preterm also occasionally maybe asked. So preterm, PROM, postdatism, extremely rarely asked. IUGR, again rarely questions are coming on this. And one of the hot topics, actually I would say it's a very interesting topic, Rh negative. Many students don't have the concept of this. It's an extremely important video, do check that out. But somehow questions are not that frequently coming, but yes, you should know the anti-D and all the Lilly's chart and the color Doppler management of Rh negative. And lastly, vesicular mole. Okay, so vesicular mole, again a popular topic and pretty important. Question may come on the snowstorm appearance. So that covers our list of entire obstetrics, and this many topics, if you know, you will surely do very well, is my guarantee. And just a quick recap. So when we look at obstetrics, the list of must know topics in obstetrics: trisomy 21, in and out, antenatal detection, double marker, triple marker, quadruple marker, amnio, CVS, NT scan, all the anomalies, drugs, your oxytocin, prostaglandin, folic acid, neural tube defects, ultrasonography, very important, NST-BPP, color Doppler, malpresentations, active management, third stage labor, PPH, VBAC, forceps vacuum, pre-eclampsia, eclampsia, the hottest topic, heart disease, diabetes, thrombophilia, Apla syndrome, APH, again extremely important, ectopic, twins, abortion, V-mole, oligo, Leica disorders. And the less important topics or good to know topics, placenta and its variation, physiological changes in pregnancy, normal labor, cord prolapse, anemia in pregnancy, thyroid disorders, obstetrics. So these are very rarely asked topics. Preterm, PROM, postdatism, IUGR, very, very rarely asked topics. Not seen many questions. And RH negative, very important, but somehow questions are very few coming, but may come in the exam. So once you master this much topic, so please focus. So in your gynecology, focus on this list of topics. Definitely do these first. This you should do first in gynecology, then go on to this topic, good to know topic, and similarly obstetrics, do these topics first and then move on to this topic. And one very, very important announcement, happy to announce that always the PowerPoint slides were available for you, and now the special handwritten notes is also available. So these notes are to be used in conjunction with my lectures. So after you finish off a video of a particular topic, you should immediately go and revise the notes. And of course, then towards the end of the exam, you can only keep on revising from the notes also, and of course keep coming back to the videos. So just is a small video that I'm going to run you through the notes, how beautiful the notes are, and it's exactly curated by me, and it is in conjunction with my lecture. So as if you will remember me, like how I'm talking. So just to give you an idea, PCOS, if you see so nicely, it is in the handwritten format font. Important points are highlighted, all the important things, as you can see, this Rotterdam criterias, and then all the recent advances also are there in the notes. Similarly, if you keep this is just an overview, and if you see pathophysiology, clinical features, so not only for NEET PG, final year students can even write a short note and a long answer based on this notes. So systematically, all the bullet points, all the tables are available, all the important MCQs are highlighted, and then you also get the tables, you also get the recent advances, and of course there are also the images. Okay, and wherever we have added, the mnemonic also has been added, and all the exam tip and how the examiners can confuse you also, all that things I have put in the notes so that you can keep a watch. All the recent guidelines are there, and as you can see over here, the important MCQs which are there highlighted, and as you can see over here, we'll just show you. So here you end up with also the images integrated in the notes itself. So this, as we can see, the famous necklace of pearl pattern, and of course then the laparoscopy view showing the big bulky oyster ovaries, and you wind up with the discussion on the laparoscopic ovarian drilling, which is a Virgin MCQ and never asked till now, may come in the future exam. So just one example, I'll run you through one more set of the notes so that you just get a idea that when we go to this test for fetal well-being, again the same thing, very neat format, indications, the important things are highlighted for you, so it becomes very easy. All these MCQs are there, of course, covered in the videos, and once you see the videos and then read the notes, nothing more is required in OBGY. So you can see over here the images are there, you can see the mnemonic which will be added wherever possible, and all the important figures are highlighted, and all the important images are also integrated in the video. And like this exam tip also we have added. So this is surely going to help you in any of your exam, whether it's INICET, NEET PG, FMGE, all the exams. So we are very happy and thrilled that these notes are going to be a part of all the complete packages, 3 months, 6 months, 1 year, whichever you take the master class. It's a part of all the master class. I'll also show you one more, the last set of notes, malpresent, like this topic of malpresentation. So systematically all the types of breach, and as you can see, images are being integrated over here, and all the maneuvers, and also wherever the images we have shown you, and all the Virgin MCQs are also covered. So lots of things which have never been asked in the exams I have taught. You can see again the image over here. So these are very, very easy for you. So many images. Okay, yes, so all these images are there, and all these notes will be available for you to read after you finished watching the videos. So my advice to the students is that first listen to my videos. After you have listened to the video, you can always go through the notes again. So nothing more is required for your OBGY preparation is my guarantee. You will love these lectures, and these notes are available for all of you. So quickly download the app, and if you haven't taken the subscription, do enroll in the app. I'm personally guiding all the students how to study, how to prepare, and you will definitely benefit from the lectures is my guarantee. You can always be in touch with me directly through WhatsApp and through the app for your timetable, guidance, list of important topics, all that I'm giving one-to-one guidance to all my students. So do subscribe to the YouTube channel also. Many more interesting videos are coming up, and definitely download the app and start your preparation today. Best of luck.